The report by the King's Fund, The Case for Change, is a very good report. If I'm honest, I don't think it's as radical as it's being billed, because actually most of the proposals that are in it are ones that David Hinchcliffe, the chair of the Health Select Committee over a decade ago, would have recognised, and certainly I recognise and very much welcome. I think it is a very good articulation of what the future could look like. But I think many of the elements are things that we have been talking about for a very long time. And the key challenge, it seems to me, is how we create the right sort of leadership that's able to make sure this new system actually comes into being. Because so many of the elements of it actually exist in practice, they just haven't been assembled into the whole. I think it will need to look and feel very different. It will need to be less about transactions between organisations and much more about the relationships that I think ought to be at the centre of any successful caring system. And that means we have to shift the narrative from one that is focused at the moment far too much on deficits, the things that people can't do, to ones that focus on the assets we have in ourselves, our personal resilience, our capacity to do things for ourselves. And that does require, I think, a new front end to the whole of the system, a system that focuses on well-being and wellness rather than just having our sickness service patching people up and sending them back out into the same circumstances that often lead to them having to go back into a healthcare system in the first place. Well, I think there has to be quite a significant cultural shift to make this new system work effectively, because it is about working across boundaries. It is about working and influencing other organisations. So, for example, it's about working between local government and the NHS. Those who simply say, well, we can fix this by combining health and social care into one set of organisations, I think miss the point. Because of the levers that local authorities get to pull that are about tackling some of the underlying causes of ill health, unless we have a combined local authority and NHS, there is no way, I think, in which we can overcome that. So we need collaborative styles of leadership. We need ways of bringing leaders from different organisations together to be trained and go through continuous professional development in ways that enable them to work across those boundaries. Yes, I do. I think they will want not to be called patients, because the vast bulk of people are likely to experience long-term health conditions. They're going to be living with their conditions in the community. It's that challenge of how we manage morbidity and comorbidity, how we combine both physical, psychological and social interventions in an effective way that's going to be the key thing. And that's why relationships are so important here, both the familial ones and the professional ones. And they're the things that can be truly transformational in our system.